star.
Hi, this is Frankie.
You woke up from a sweet dream, and now you're looking so damn pretty. Don't even know what happened between now and then. You look around, it all looks blurry. Then he leans over and says, don't worry, because darling, you're safe in my hands. Oh, you're safe in Frankie's hands. Behind the drapes with Frankie.
Good morning.
Hey, good morning.
I'll be asking you some questions today.
Yeah, go ahead.
What's your name?
Frankie.
What is your specialty?
I do anesthesia.
Where did you go to for your undergrad and your grad school?
I went to a school in Orlando. It's called Adventist Health University.
How long does it take to become a nurse anesthetist?
It takes about almost 8 years.
What made you decide to go into anesthesia?
When I was in nursing school, one of the rotations was in the operating room, and I met a nurse anesthetist that was doing open heart procedure, and I knew for sure that that was what I was going to want to do.
What types of work can you do as a nurse anesthetist?
There's actually most nurse anesthetists, they work in the operating room setting doing the anesthesia itself. But some of them specialize in pain, and some of them actually work in labor and delivery, doing epidurals and spinals for babies.
How many years have you been practicing anesthesia?
Let's just say it's been over 10 years.
How is your typical day like?
Typical day, it starts like this. I get to the clinic and I set up for my first case of the day. Usually the day before, I review the chart of the patients. And I set up my room, make sure the anesthesia machine is working properly, draw up my medications, and then after everything is set, I go and see my first patient in the pre-op room.
What is the best part of your job?
The best part of the job, especially coming from a nursing background, is actually having that, you're having one-to-one patient care. Like you only have one patient that you're taking care.
What is the funniest thing you have ever seen on a chart?
Well, without going through any HIPAA violation, I had a chart way back when I used to work in the hospital that the patient reported oxygen as one of their allergies.
Who should not consider anesthesia for a profession?
If you don't like to be in any situation that you have to think on your feet, that you have to deal with stressful situations, then this wouldn't be a profession for you.
How many patients does a nurse anesthetist see in a day?
It varies in what kind of setting you're working in. I've had situations where I work in endo clinics where I'm doing endoscopies and colonoscopies, and I've done up to like 20 cases in a day because they're very quick 10-15 minute procedures. And then there's some situations in some cases, especially when you're working in a hospital, where there's cases that go well over 12 hours. So only one case in that day.
Do you still work in a hospital?
No, I actually stopped working hospital about, I'd say, 5 or 6 years ago.
Why did you leave working for the hospital?
Well, my daughter was probably 3, almost 4 years old, and I was having, the situation where I was in is I was being on call frequently during weekends and a lot of nights. So I was not being able to be there, and I only have one daughter. So I wanted to be able to be more part of her life and have more of a, not quite a set schedule. I don't have a set schedule, but at least I know that most evenings and weekends I'll be at home.
What advice would you give to someone thinking of becoming a nurse anesthetist?
Seek out a nurse anesthetist or an anesthesiologist and ask them to shadow them in the operating room to see if it's actually something that you'd like to do.
What was your most challenging case as a nurse anesthetist?
So I always thought that heart surgery was going to be the most challenging, and I was surprised that actually a liver transplant. And those cases are very intense and work heavy, and you never stop for not even 1 second.
Who are you most thankful for in your team?
Oh, wow. Well, I'm thankful for everyone. Everyone from the OR circulators that helps us every day, the assistant that sets up everything up for Dr. William, for having me here and trusting me with his patients. But one person in particular that doesn't get a lot of credit that I'd like to do a call out for is Melissa, who prepares the patients every day. And she does a phenomenal job preparing the patients and letting me know that they're ready.
Now, for some more personal questions, are you from the US?
No, I'm from Brazil.
Okay, what did you move to the United States?
I moved here back in 2002. Yeah, end of 2002 is when I moved to the US.
Why did you move to the United States?
Wow, there were so many reasons, but I guess that, and when I moved to the US, I didn't think I was going to be staying here. My purpose was to stay here a couple of years, experience the life of living in the United States, and actually my plan was to go back, but I ended up just, falling in love with it and falling in love with here, and I wanted to chase the opportunities that the US has to offer that are sometimes very difficult back home.
What do you like to do on your time off?
Oh, well, I work a lot, so I like to relax on the couch or by the pool outside with my daughter.
Do you have a pet?
Yeah, I have a dog named Waffle. He's huge. When I got him, he was supposed to be a mini Bernedoodle, but I think they tricked me because he is just massive of a dog.
What kind of music do you like?
Maybe this is gonna date me a little bit, but I'm more of a 80s and 90s pop rock fan.
And to wrap it up, does your family ever ask you about medical advice?
Yes, they ask me about medical advice all the time, and all I say to them is look for your primary care physician with those questions.